So when I have the opportunity to lecture and present, whether it's to fellow physical therapists, chiropractors, dentists, massage people, or to the public, doing various presentations, I make it very clear the temporomandibular joint is one of the least understood joints in the human body. And unfortunately, for many of us who are in healthcare, it's a very small percent of how we're educated and what we're taught. So it's very important for those that are suffering with temporomandibular disorders, or TMD as we like to label it, that you seek out practitioners, an excellent dentist, a excellent physical therapist that has gone above and beyond to receive significant training in the treatment of temporomandibular disorders. We know that it tends to be more common in women than men, that there's somewhere between 7 to 15% of the population is actually suffering with temporomandibular disorders, but they may go undiagnosed. Very common that a lot of our cervical patients with neck pain, whether it's from a car accident or a simple slip and fall or postural stresses, can also have underlying temporomandibular problems going on. Very high percentage of our headache and migrainous patients have temporomandibular issues that are running in the background. They not always have to be running together at the same time, but it's very common that many of our temporomandibular patients that are suffering have multiple other issues going on, to include headaches, neck pain, maybe even abdominal pain, irritable bowel syndrome, lower back issues. So really, it's so important to have a very good understanding and treatment knowledge on how to manage the variety of conditions that can present, even if someone just walks into your clinic with temporomandibular disorders. It's been a very rewarding opportunity to work with these patients because, again, there's so many millions of people suffering with this problem, but not very good access to healthcare, and specifically access to clinicians that have the level of experience, let's say, that we do at Freedom Physical Therapy and the multitude of physical therapists that work together here to and with dentists and endodontists and orthodontists. It's really a multidisciplinary approach, but a very conservative approach. And I think that's the key message I want to put out there as well. So many people with temporomandibular pain, temporomandibular joint issues can respond very well to conservative care. The need for surgery is rare, but it can be a lifelong management situation as well. But with good instruction, good care, hands-on care, an excellent evaluation to really determine, is this a muscle issue, is it a joint issue, is it both going on at the same time? But the outcomes can be fantastic with wonderful, great conservative care. Again, combining good physical therapy, good dental intervention, possibly a fabricated, customized orthopedic appliance or splint. You need to look at airway, you need to look at sleep. So there's lots of factors that you really go into providing good, comprehensive care for people suffering with temporomandibular pain, temporomandibular dysfunction.